Gastric Bypass Surgery. Introduction. Obesity can cause diabetes. Select true or false. Correct. Obesity is the primary risk factor for diabetes. Which of the following body mass indices indicates obesity? Choose one of the following options. 1. BMI of 24. 2. BMI of 29. 3. BMI of 34. Correct. A BMI of 30 or more indicates obesity. Please point to the duodenum. Choose one of the following options. Correct. Many nutrients are absorbed in the duodenum. Doctors recommend bariatric surgery for patients who are overweight with a BMI of 25 to 30. Select true or false. Correct. A BMI of 25 to 30 is not sufficient to recommend bariatric surgery. The advantages of laparoscopic operation are less discomfort and faster healing. Select true or false. Correct. However, not all patients are eligible for laparoscopic gastric bypass surgery. Which of the following is true about gastric bypass procedure? Choose one of the following options. 1. It makes the stomach smaller. 2. It bypasses the duodenum where food absorption takes place. 3. All of the above. Correct. Gastric bypass surgery reduces both the size of the stomach and the absorption in the small intestines. That is why it is known as a combined bariatric procedure. Infections are common during or after gastric bypass surgery. Select true or false. Correct. Infections are uncommon. However, they can still occur. Patients will need to take vitamin and mineral supplements after gastric bypass surgery. Select true or false. Correct. Gastric bypass surgery always produces weight loss that is not gained back. Select true or false. Correct. There are no guarantees that weight loss will be maintained. Success is possible only with the patient's full commitment to changing eating and exercising behavior. Patients will be on strict nutritional diet after the gastric bypass surgery. Select true or false. Correct. The amount and type of food you eat will be regulated after your surgery. Select true or false. Correct. The type and amount of food you can eat will be regulated after your surgery. The way you eat will also be regulated. For instance, you should not eat fast or drink fluids with meals. After gastric bypass surgery, you will need to take vitamins and mineral pills for the rest of your life. Select true or false. Correct. Because the digested food bypasses parts of the small intestines, nutrients are not well absorbed. The supplemental vitamins and minerals help to avoid nutritional deficiency. Thank you for using Explain.